Hello and welcome, everyone. Welcome to the Model Law Knowledge Lab on Overdose Fatality Reviews. It's great to see all of you joining us today. I am Becky Rose, the Senior Director at Rulo Strategies, and I'm part of the team that is supporting the Legislative Analysis and Public Policy Association, otherwise known as LAPA, to bring you this Knowledge Lab today. I am joined by my colleague, Tara Kunkel, who's the Executive Director at Rulo Strategies, who you'll hear from throughout the discussion today as well. So we wanted to give you a little bit of background. What are knowledge labs? Why are we here today? So we are presenting these as virtual learning series that provides you all, stakeholders at the state and local level, with an opportunity to deepen their awareness and understanding of how model laws can assist jurisdictions in addressing substance use disorders. And today we are going to talk about the overdose fatality reviews. These knowledge labs are made possible by a grant from the White House Office of National Drug Control Policy. And I'd like to offer a special welcome to staff from ONDCP who are here with us today. And thank you all for the support to be able to bring these knowledge labs to our partners and stakeholders. In addition, we are joined by representatives from LAPA who have led this project on behalf of ONDCP. So a very special welcome to Sarah Kelsey, Susan Weinstein, John Woodruff, and Stephanie Noblet. The LAPA team will be engaging in the chat, answering questions, and sharing relevant resources throughout the lab today. Just a little bit of housekeeping before we get started. All attendees are muted, but we can interact with you through the Q&A box and the chat box in your Zoom control panel. So you should have those options to type in questions in Q&A and also type in messages in the chat box as well. So if you need anything, please let us know. If you have any logistical questions, you can chat directly with me, or you can email me at rebecca@rulostrategies.com as well. So during our discussion today, we are going to hear from experts on overdose fatality review efforts. I want to thank you for sharing your questions during the registration process. We got a lot of great questions from you, and we have shared those questions with our panelists. And hopefully we'll be addressing these throughout the conversation today as well. So thank you for providing that information in advance. In addition, we encourage you to ask questions throughout the presentation today in the Q&A box, and we will try to get to them at the end of the conversation today. So please, as questions come up, go ahead and type them in the Q&A box, and we will respond to them as much as we can. This session will be recorded and will be made available on the Knowledge Lab website on the LAPA website in a few short days, and we will also share it with you as well. Now, I'd like to introduce our moderator today, Lauren Savitskis. Lauren is a senior research associate at the Institute for Intergovernmental Research, or IIR. She works on the Bureau of Justice Assistance's comprehensive opioid stimulant and substance use program to support and enhance overdose fatality review teams across the country. Prior to joining IIR, she was the suicide and OFR program manager with the Indiana Department of Health, where she led the coordination, facilitation, and implementation of the Indiana Suicide and Overdose Program, including facilitating state and local suicide overdose fatality reviews. She brings a wealth of expertise along with our other panelists today. So Lauren, welcome, and I'll turn it over to you.
Well, thank you, Becky, and hello, everyone. I'm so excited and happy to be here with you all to discuss such an important topic. So our objectives for today's discussion are really to learn from the experts who are with you on this call with respect to their efforts in overdose fatality reviews, or OFRs, as you will hear them referred to today, to really learn why it's important to address this issue and share ideas on varying approaches to initiate this work in different states. So I want to start off by grounding everyone in this kind of the process of overdose fatality review, which may be new to some or, be old practice to others, but overdose fatality reviews are really grounded in this experience that overdose deaths are preventable. And these deaths can be prevented with coordinated prevention strategies, timely implementation of evidence-based interventions, community mobilization, and data sharing and collaboration across agencies. The purpose of an OFR is really to identify system gaps and innovative community-specific overdose prevention and intervention strategies. So what does an OFR do? Well, in practice, they involve a series of confidential individual death reviews by a multidisciplinary team. These death reviews or case reviews really look at a decedent's life cycle in terms of their drug history, comorbidity, major health events, social emotional trauma, any encounters or engagements they might have with law enforcement and the criminal justice system, any treatment history, and other factors to really facilitate a deeper understanding of any missed opportunities for prevention and intervention that may have resulted in a non fatal overdose. By conducting a series of OFRs, jurisdictions will really begin to see patterns of need and opportunity, not only within their specific agencies that they represent, but across the various systems that are at the table. When you blend input from public health, public safety, providers, and community members, OFR team members develop program and policy recommendations to improve the coordination and collaboration between agencies and community conditions to prevent future overdose deaths. So these recommendations that the teams are able to identify are then presented to a governing committee that supports and provides resources for implementation and a framework for accountability for that action. Um, so some examples of successful recommendations you might hear include really the integration of peer recovery support specialists distributed naloxone in targeted areas, and really improving the coordination of public safety and public health. So when you get all these folks in the room from various agencies and their different sectors, it really allows for a much richer understanding and communication that is unlike any other meeting that members attend. I can say in my personal experience, having facilitated a lot of these OFRs, I've seen partners who have other meetings together really come together and share policies and procedures to identify where they can better respond and work better and more collaboratively across the various systems that result in recommendations that ultimately save lives. So enough from me. I'd like to introduce our expert panel that will be joining us today. I'm going to start with Melissa Heinen, my colleague at IIR. Melissa is a manager for the Institute for Intergovernmental Research. She is responsible for overseeing overdose fatality reviews and harm reduction, training, and technical assistance. She has more than 25 years of experience working in injury and violence epidemiology and prevention at the local, state, regional, and national levels. Thank you for joining us today, Melissa. We're also going, oh, go ahead. You could say thank you. We're also going to hear from Heather Koya today, who is a licensed independent clinical social worker who serves as the State Overdose Fatality Review Coordinator in the Drug Overdose Prevention Program at the Rhode Island Department of Health. Heather has been supporting the Rhode Island OFR team since 2020 and provides a collaborative strategic approach to ensuring that the team is impactful in driving public health decision-making amid the state's overdose crisis. And last, but certainly not least, is Karina Havenstrait. So Karina currently serves as the Director of Program Management for the Lackawanna County, Pennsylvania District Attorney's Office. In this role, she led the development of the Lackawanna County Overdose Fatality Review Team and oversees the implementation of recommendations generated by the team, as well as the pursuit and management of several other law enforcement and opioid-related grants. So welcome to our three panelists. And to really start our conversation today, I'd like to give each speaker a chance to welcome our attendees and share their perspectives on why they work in overdose fatality reviews.
Well, thank you, Lauren, and thank you for everyone for joining today and digging in and learning a little bit more about OFRs and why they might be a great strategy for you in your community. So, I'm Melissa Heinen, and I have a background in nursing and in epidemiology, and I think that understanding of we need to understand the data in the community and what the conditions are and the drug trends and all of that. It's a starting place that we need to begin our work, but then really understanding that the individual story is where we begin to see those missed opportunities is why I love the mixed approach of OFR. And in the landscape that we get to have here at IIR, we get to see what is working in all the communities and begin to elevate and support them to be implemented across the country. And we're seeing time and time again that OFRs are really becoming strategies communities are going towards to use to inform their prevention practices. So really excited to dig in more with you all here in a bit, but thank you everyone for tuning in.
Thank you, Melissa. Heather, I'll turn it over to you if you'd like to share your perspective on why you work in overdose fatality reviews.
Sure. Good afternoon, everyone. As Lauren mentioned, I'm Heather Koya, and I am the Overdose Fatality Review Coordinator for the state of Rhode Island. And I have spent many years as a social worker working with people who use drugs, as well as people who love people who use drugs. And I'm also a family member of multiple people in recovery. So several years ago, after I lost a very dear client of mine to overdose, is where I entered the prevention and harm reduction spaces, if you will. And I eventually went on to develop and implement a post overdose outreach program with the local police department, and that's where I really understood and was able to actualize the value and the importance of cross system collaboration. So, across public health, public safety, behavioral health, and really seeing how what work and what incredible work can be done when those sectors come together. And so, that's one of the reasons why I really value OFR. It makes sense to me, particularly when we're exploring points of prevention, when we can have everybody at the same table. Thanks for having me today.
You're welcome. Thanks for being here. Karina, would you like to come and share?
Yeah, absolutely. Thank you so much. And thank you guys for having me. I'm really excited to be presenting today. As mentioned, my name is Karina Havenstrait. I am the Director of Program Management at the Lackawanna County District Attorney's Office and oversee our overdose fatality review team. For me, my previous history before I was at the DA's office was working in HIV. So I come from a background of social work and public health. So I was seeing a lot of my clients in the HIV world and the impact that drugs had on them and on their treatment and on their lives. Also, I feel like I've personally been to just entirely too many funerals. I've, lost a lot of people from my childhood and, for me that combination between the professional life of firsthand seeing the impact that drugs and alcohol have and then, personal side of just attending so many overdose funerals. And also with working on in HIV on the harm reduction side, harm reduction made sense to me. It was something I understood. So transitioning to the opioid space and, working in drugs and alcohol and implementing a program like OFR kind of combines all of those things and really does strive to have a deeper understanding and reduce stigma and really make data driven responses, which I said it all just made sense. And I'm happy that I've gotten to be a part of it.
Amazing. Well, as you all can see on this call, we have a wealth of expertise ranging from the federal level, the state level, and then the local level. So I'm really excited to dive in with you all today in some of the questions that we have for you. So I'm going to start with Melissa at the federal level. Can you really share with us what the big picture perspectives on OFRs are? So what are the objectives? How do states really approach this work? And then any resources available to explain what they are and how they work.
Yes, thank you. I mean, you did a really nice job at the beginning, Lauren, kind of setting the stage for um why we do OFR, what's included in OFR, all of that. But I think it's important for everyone to understand that, as I mentioned, OFRs are growing across the country and they're starting at the local level and they're starting at the state level. And we're seeing state by state, team by team come into play. And they're really coming together because they are trying to coordinate and bring together all the various sectors and partners and people around the community and service agencies that can play a role in preventing overdoses. And then it needs to be more coordinated. It needs to be this multi-sector response to really see the impact. And so what we're starting to see is we're starting to see state health departments and state agency staff hearing and from their local teams that are pulling together OFRs and implementing them saying, hey, these are great. We've been able to do this, this, and this, and this. And then they're hearing from communities that are saying, what is OFR? We might want to start one. What can you do to help us? So in this last year, we've really seen states step up and try to do some self-reflection and think about, okay, what can they do behind the scenes to build an infrastructure to support local OFRs? That might be what data do they have that they can share? What what legislation is in place, what supports do they have in regards to any dollars that they could use to either implement recommendations or begin forming these teams. So we're starting to see states identify themselves as having a role in supporting local OFRs and giving them the tools they need in partnership. It's been wonderful in partnership with us here at IIR. We at IIR, we work on behalf and in partnership with our federal funders, which is CDC and BJA, and really try to build the tools and the standards for teams to get the most out of their effort. Everyone is so busy and they're all trying to do so much. So we want when they come together to have the best resources possible to get the most out of that partnership. So we have a practitioner's guide to implementation for OFRs that's available. And it is sort of your workbook for how do you begin bringing an OFR together, from who do you recruit? How frequently should you meet? What should your meetings include for data? How do you store your data? So we have that in place. We also have a companion document, which is public health and safety teams, that was originally developed by CDC Foundation, but now is available through CDC. And that's a companion document that walks people through what aggregate data, what is some population data that might help you better understand your community substance use trends, your social determinants of health, your death data. And that is available. So those are really the anchoring documents if you're just beginning to do this work. As teams have been doing this important work, we have been listening to them and observing them and seeing what is working and what's not working so well. And based on that, we were able to put together a national standards document where we really say, okay, there's all of this included in OFR, but what is the fidelity of the model? Like, what do you really need to have your OFR work well? So we distill that down into the national standards, and that is available. We've also built a database where all these teams are bringing all these partners together, and they would like to put their information and their recommendations and who was at the meeting and all of this information in one standardized tool. And so we developed the OFR data system. It's free, it's available. We have training and support. So we are really hoping teams are seeing us as a place to go to say, where is this? Or it doesn't exist, or what team is doing this well? And we can kind of be the air behind them or walk beside them to get them what they need so they can really focus on what's important, which is bringing their partners together to build trusting relationships to address their overdose crisis and do the work in the community. So that's what we're seeing, and that's what we're trying to do here.
Do you want to share a little bit more about what existing teams can find on the website and what kind of convenience and resources are available to those sites who are a little more advanced in their practice as well?
Yeah, for those that are more advanced in their practice, we have available, we recently launched our Next of Kin interview training tool that's available. We also have a toolkit on how to embed self-care, because after a while, these partners, they're exhausted. They are, this is hard work. And so you're coming together to do even harder work. So how do you do that in a way that is thoughtful and considerate of everyone's experiences? So we have embedding self-care. We also have some videos that we have available. So if you're trying to market or explain what OFR is, those tools are there for you to use to promote the efforts. We have a mid-year meeting coming up, a virtual one this fall, where we'll bring everyone together and talk about how do you identify and implement recommendations. That's the whole point of this, is to find those gaps and make some change. So how does that really look like? And with that, we're going to highlight a specific area of recommendation generation, which is around hotels, motels. So what are OFR's teams doing to address the need in working with lodging and hospitality establishments? So we're always trying to balance, supporting those that are just beginning and trying to hear from those that are doing what's working well so they can share with others. And all of that is available on our website, which we can drop in. But we are launching the end of this, I think I can say this, the end of this month, we're launching our new website, which is www.ofrtools.org, ofrtools.org. So you'll be able to find all these things there.
Thank you, Melissa, for sharing all of that. I'm so glad that you mentioned and identified what state health departments can do to best support OFRs and how there is this push to determine and help build out an infrastructure at the state level and what state OFRs can look like. So, Heather, I'm going to turn to you. We'd like to hear from you about your experience working at the state level to implement and maintain an OFR. Can you share with us a little history about Rhode Island's history with the OFR legislation? When did it start? What are the most important pieces of that legislation, and how has that changed since its initial implementation?
Sure. So Rhode Island has quite the legislative journey, if you will. So we actually began convening in 2016, and then our legislation took effect in 2018. So not a ton of time in between when those proposals kind of started happening. And for context, our OFR legislation technically falls under our Office of our State Medical Examiner statutes, and our medical examiner's office falls under the Department of Health, which is where OFR lies. So after our legislation was established, we did build up our team. We made connections with our community stakeholders to become team members, et cetera. And we continued to hold case reviews. So things were going pretty well. We were building our team up. And then in 2020, in December at the end of the year, right? And we can all recall what 2020 brought on. But our original legislation did have a sunset provision, and so it expired. 2020, as I mentioned, was when COVID kind of entered the picture, and unfortunately, there was a lot going on in health departments at the ME, lots of different things, right, for the world. And so it took some time to get it amended, but it was amended and reinstated in June of 2021. So we had like that 6-month period where we didn't technically have any legislation. We did continue to hold case reviews with our state agency partners during the year. That is one of the benefits of being a state agency, right? We do have data use agreements, data sharing agreements with our other state agencies. Excuse me. So we were able to hold a couple case reviews during that time with just them. But we really, really felt the sunset of the legislation because we lost the ability to have what I feel is the most important people in the room, which is our community partners, our experts, such as people with lived experience, providing their perspective during case reviews. So I do think that that's probably one of the most important pieces of legislation is the language that allows the OFR team to have all the right people at the table. Our legislation doesn't limit, but it does call out certain folks that should be there, folks from public health, people from the recovery space, things like that. So those people are covered, but we want to make sure that we have the right people at the table. As I mentioned, we did reinstate in June of 2021. So we've been meeting since then. I would say confidentiality is probably another primary component that I always think of when people ask me that question. Not only to protect and honor the decedents that we talk about, but and the people that love them, but also our team members, right? So we want to make sure that they're feeling safe participating. We want to make sure that they feel safe being data sources and sharing information with us, that they can't be pulled into any type of criminal or civil or legal proceedings. So we have that as part of our legislation as well. Lastly, in terms of additional changes to our legislation since it began this past June, super excited to talk about the fact that we have had language added as a supplement that will pave the way to permit a statewide family outreach program that will be a kind of supplemental project to our OFR.
Great, thank you. And then, Karina, I want to get your opinion in this as well and hear a little bit about your history. As someone who's representing a local county, can you discuss how your OFR started at the local level and how you coordinate with the states?
Absolutely. So our team is pretty unique because it's led by our district attorney's office in a county that didn't have a Department of Health at the time. We are in the process of developing our Department of Health, but our entire overdose fatality review team was implemented without one. So that, makes us unique. And then the fact that we are led by a district attorney's office is also not unheard of, but definitely not the norm. So our OFR team came about, I would say, just because of our district attorneys and one of our key staff um, who was involved with child death review really just their desire to do more, to understand and, effectively address the epidemic and, all of these issues that they were seeing related to, to drugs, and really try to understand what was happening and have some real, positive impact and really get a grasp on what we could be doing better. So we were awarded a COSAP grant in 2019. Just like Heather was saying, things kind of went a little crazy in 2020. So we did have a delay, but we were able to start. We had our first buy-in meeting in August of 2020 and our first case review in October of 2020. And we've met every single month since then. So especially in the beginning of our reviews and recommendations, most of our recommendations were limited, to the confines of our county because we are a county initiative. And especially in the beginning, you're kind of, grabbing that low hanging fruit and those recommendations that are easier to implement. So I would say in the beginning that tended to be more, where we were focused. But now that we've been reviewing cases for almost 3 years, we've definitely been seeing some more far-reaching goals and the need for increased collaboration. So we have, because of that, added some state-level representation to our team. So we have added Pennsylvania Department of Corrections and Parole, and we're currently in the process of working to get representation from Pennsylvania State Police and CCBH, who is our mental health and drug and alcohol funder for Medicaid. So we're working on collaborating with them to really get some more higher level understanding and be able to implement some recommendations outside of our counties. When I think of, us working with the state efforts, I think one thing that really stands out that we did collaborate more outside of our county limits is when it comes to the decriminalization of fentanyl testing strips. So that is something that was talked about a lot in our case reviews from a harm reduction standpoint. Honestly, when our district attorney found out that they were still illegal in Pennsylvania, it kind of blew his mind because it doesn't make any sense. So we actually tried to decriminalize fentanyl testing strips on a local level and were unsuccessful, unfortunately. So we did retarget our efforts on, raising awareness and really starting discussions about fentanyl testing strips and harnessing support for pending legislation for decriminalization. One of the biggest things I think that we were able to help achieve is that the District Attorneys Association did publicly support that legislation, which I think was helpful. And I'm super excited to say that it did pass in Pennsylvania last year. So we are really excited to really start utilizing that as a harm reduction, part of our harm reduction toolkit, and, do a little more work in that space. But that is something that we did do and work with, more on a larger scale. So I also think that just maintaining communication and collaboration with some of our other Pennsylvania OFR teams has been really important. So Philadelphia, for instance, was critical when I was developing our team and really just trying to have that collaboration on the state level. We've been, trying to talk and collaborate as much as possible with all the teams throughout Pennsylvania, and really just building those connections and continuing to collaborate and work to impact not only within our county as a county initiative, outside our county as well.
Thank you. I think it's really interesting how both you and Heather are talking about how you intentionally include representatives from state and local jurisdictions throughout your OFR process, and are really being intentional in that and making sure you're collaborating with local communities and local communities with states. And as you all can see on the call, OFR looks a little different across each state. You're hearing from Lackawanna, Pennsylvania, and Rhode Island, but IR and Melissa will be able to share a little bit more on this, that OFRs in different states and jurisdictions just look a little bit different, whether that be the legislation or not having legislation. So Melissa, I'm going to pivot over to you and ask you, What are some similarities and difference among states who have created overdose fatality review? Can you address how the model law can be used to support states that are just getting started?
Yeah. So when we take a look across the country, we see states that have funding to support OFRs and states that don't. We see states that are supporting and hosting our OFR data system on their state server so that their teams can enter their data. And we see those that aren't. We see states that have TTA, um, where they convene their teams, they provide ongoing opportunities for those teams to talk. Some don't, right? We see states where they are very intentional about trying to hear from all their local OFRs and get recommendations so they can kind of see across their state what recommendations are coming up. What does the state need to try to move forward and help support at a state level? It really does vary. We have some states that they have a state level OFR, but no locals, right? And that is often the case, as we've heard today, depending on the size and the population of your state. What we do know is most OFRs started and are currently running without legislation, but that legislation can really make a difference in regards to the amount and the quality and the quality and quantity of data that is provided and how it's provided to the partners, how much open discussion there can be about the individual's life versus only some of the people in the room knowing what's going on and what case is being reviewed. The beauty about OFR is it's a framework and you can scale that framework. You can bring that framework to any community and make it work for your community so that if you have better partnership or better data from certain partners, you bring that data in and you work with it. You don't go, oh, we're not going to have an OFR because we don't have all 8 partners, right? You take the framework and you do in your community. So the beauty, though, about the model law is while we have available on our website information guidance documents, so when you look at HIPAA and 42 CFR, those federal rules, regardless of your state, it can make it challenging sometimes when you go to a certain data provider, such as school systems, and say, hey, can we get information about this individual who died of an overdose? And having each separate agency try to understand the rules and parameters at a federal level as it applies to them is just not effective. So we have information guidance documents that help you understand at a federal level what's allowable, what's not allowable. And then you have each state. So each state is different in regards to what statute that is already existing for fatality reviews, what agency is leading the OFR can make a difference. Do you have public health authority? Do you have death scene investigation authority as the MD? All those things differ across the country. So the modern law, which was really built off of the experience with other states that have had a longer history and have had legislation in place, was built to support states across the country as they begin to want to not only understand the federal parameters, but understand their state parameters, that they can use the model law to begin to have conversations. Now, those stakeholders in the community who are allowed to introduce bills and stuff like that, they have the necessary language and understanding of what would be a good law versus a not so good law based on other states' experience. And it really has resulted in everyone having conversations about who are the champions in the community that want to move this forward. And by finding those champions in the community that want to move this forward, you also find champions in the community that want to begin implementing those recommendations and find the value of OFR. So I think I answered it in saying it really varies by state and locality. It's a framework. We have tools to support you, but the model law, if your state is interested in starting, can really be a great tool to use. And we've seen a lot of states reference and build their bills and their laws off of that and start to introduce them into their state system. And we anticipate we're going to have more OFRs then that are able to share quality data from new and more robust set of partners because of it.
Thank you, Melissa, for sharing. You really highlighted how legislation can really help support some of the data sharing to inform the OFR and bringing additional agencies in when you have that. Heather, I'm going to pivot to you because you use family members as a source of information for your OFR. So, can you talk a little bit more about outreach to family members? How does that work with your OFR? And can you share the value of talking with family members and how that information can help inform the recommendations of an OFR team?
Yes. So we have not been able to actually implement yet next of kin interviews, but it has been on the OFR's mind, our Department of Health's mind for several years. And so we've been working, me specifically, the last 3 years at being able to get this additional legislation that I mentioned to be able to do this. And so I've talked a lot of with probably some of the people on this call, other OFR teams that have been able to implement those family interviews, those family conversations. Because in Rhode Island, we really became aware of the limited amount of resources available for families and people who love someone who uses or misuses substances or loses somebody to overdose. And so we've really learned that from OFR recommendations as well as other spaces in our state. So the purpose of this statewide family outreach is twofold. First and most importantly, we provide or will provide brief bereavement support and resources to the next of kin of people who have lost their lives to a fatal overdose in Rhode Island. First and foremost, it's about them. What do you need? Even if it's something like basic needs. Do you maybe would like support and recovery supports for substance use? And so it's really about them. And then secondly, it is to provide an opportunity for families to share their experiences and their perspective. Um, Now, after being with OFR for so long, we are constantly finding out that there's gaps, right, in our information. And you can get as many, I mean, we have multiple data sources. If I had to estimate, I think it's somewhere around 8 or so of folks that contribute kind of their information about the people we discussed. And no matter how many records you get, there's just nothing like hearing from somebody who knew the person that you're talking about. And so it really provides valuable information about those individuals that we discuss, fills in those gaps that you just can't get from other sources. So we learn about who this person is, what their life was like, particularly in that time leading up until their death. And so, as someone who's kind of done this type of family outreach work before on a much smaller local level, it can be very healing as well for families to talk about their loved one, not just their death, but their life, who they were, and a supportive environment. Because unfortunately, for some folks with the prevalence of stigma that we all are way too familiar with, they might not even have those spaces to be able to openly share about what their experience was with their loved one or what their loved one's experience was. So there's kind of really both that twofold uh, uh, thing going on at the same time where we're learning from them and they're also hopefully benefiting it from it as well.
Thank you for sharing that. Karina, can you talk about the partnerships with your local OFR? How have you been able to engage local partners such as law enforcement to gain buy in for this process? And who are your other key partners, and what advice do you have for any partners that are maybe a little reluctant to be a part of an OFR?
Absolutely. So we're really lucky to have some really phenomenal buy-in and partnerships within our OFR team. However, I will say that I think it's been a little easier for us being led by the district attorney's office, and having the district attorney's support. I can ask and I can talk all I want and ask people to help me out with things. And I'd like to think that sometimes people listen, but when he asks, people actually listen. So I think that has helped us along in our journey as far as successfully implementing our team as well as, some of our recommendations. I think it has made people a little bit more comfortable with some of the confidentiality concerns because they know it has his support. And particularly when it came to law enforcement, because that is often when I'm working with other teams, one of the hardest areas to obtain buy-in. And that really wasn't an issue for us because as the lead law enforcement officer in the county, he was able to just tell law enforcement that they were going to do it and that they were going to share data. But even then, I think it's really important to have the right people on your team, especially when it comes to law enforcement and, some of those organizations and team members that might have additional stigma. Really having the right people at the table who believe in addiction and believe as a disease and who believe in recovery and who want to be a part of this work and aren't just assigned to be there, I think is critical to the success, of your team. Also, I think it's really important to make it very clear when you're trying to obtain buy-in, not only what overdose fatality review is, but also what it is not. So I think so much we talk about the goals of overdose fatality review and the benefits of overdose fatality review, but I think when you're talking about buy-in and trying to get buy-in from people, that discussion of, yes, this is what OFR is, but this is also what it isn't. Staying very clear on the fact that it's not about pointing fingers and it's not about finding blame. Um, for instance, I think for me, I kind of just think that we are all trying to do that the best we can in our roles. We're all in these positions because we believe in what we're doing and we're all doing the best that we can. But the reality is often that, we are being pulled in a lot of directions and, we are trying. And when there are, issues or missed opportunities, it's not because we as a collaborative team don't want to be doing better. Sometimes it's, we don't necessarily have the capacity or the knowledge to do better. So I think making that clear when you're trying to get buy-in that, we're not trying to find what everyone's doing wrong. And if we do find it, it's not the fault of that person or that organization. It's just something that we need to acknowledge and work together to resolve. And I think that is helpful when you're trying to obtain buy-in because I think a lot of people are afraid of what will come out of these reviews, that it's going to make them look bad. And, really owning that and making it clear is important. And I think for me, having facilitated a lot of meetings, I think it's important as a facilitator to remember that too. And really, as recommendations are being implemented and as discussions are being had, sometimes you are going to have to come in and just reinforce, hey, we're all really trying. And like, yes, there is something we could be doing better. And how can we as a team work to support this organization to make that happen? So I think that is something that can help. And also, validating concerns. Confidentiality is a concern when it comes to overdose fatality review. So when people ask questions and are a little reluctant, it's it's easier to be like, yes, this is concerning. And on the national level, we talk about it all the time. And we're working nationally and we're collaborating with teams all over the country to figure it out. I also think that for reluctant partners, I think the best way, in my experience, to handle it is, like I said, validate the concerns, but also to work with them on an individual basis. So meet with them individually, talk over what their concerns are, talk over exactly what OFR is and the recommendation or the requirements and what they're going to need to do. But also, alter some of the wording on the policies if you can. We've done that with organizations that they're like, we agree with this, but like our legal team is having issues with like this little tiny piece. And it's like, okay, well then let's change it. Let's discuss it. Meeting people where they're at, which there comes my harm reduction background again. I think it really does come down to, validating people's concerns, meeting with them one-on-one, acknowledging the concerns and working with them to address them. I think also, if they're not willing or able to provide the data that you're looking for, making sure that you invite them to participate in whatever capacity they're able to. I think so many times it comes down to being, if they can't give us data, then what's the use of them being here? But I will absolutely say that some of the best discussions and the best recommendations that we've had have come from our subject matter expert capacity individuals and participants. So I think inviting everyone to the table and letting them participate in whatever capacity that they have is the best way to handle reluctant partners. So I also, when it comes down to our team, we have about 15 to 20 organizations that participate and provide data every single month. And all of them are critical to the success of our team. But when I think of some of the ones that are really our key stakeholders and really tend to be more involved, I'd probably say our coroner's office, our county drug and alcohol, our central coordinating entity for naloxone distribution, who is our local EMS agency, our medication assisted treatment provider, mental health, youth and family services, probation, parole, and the prison. There are more, but I think that, those tend to be the ones that for us at least provide the most data and tend to be most involved with the recommendations. That was a little long-winded, so I apologize. I
No,
am
you covered a lot of really wonderful information, and thank you for sharing that. I think it is so important to remind folks that this is not a blame game or a finger pointing exercise. It's really learning together with each other. So I appreciate you pointing that out. And then to that point, I'm going to pivot to Heather around this continuing working together with agencies. Do you have any advice or suggestions for agencies working together on their legislative process when they're introducing OFR related legislation in their states?
Yeah, absolutely. The first thing I would say is this is probably what I say about any type of OFR work is don't be afraid to start small, just start. Just start somewhere. We don't want something like wanting to have everything right away or feeling overwhelmed to stop us from taking any action. I know personally when I got into OFR and I started attending webinars and hearing all of the amazing things that other states and counties are doing, and I was like, I have no idea how this is going to happen here. But just really starting small and starting somewhere, don't getting paralyzed in those kinds of thoughts. Leverage your current partnerships and resources and just start with the basics. Listen to what concerns people may have, both from your partnerships and agencies that you already have going, and then maybe even others as well. And then work together amongst yourselves to address them. As you heard, our legislation didn't initially cover all of the foreseeable needs of the OFR when it was first implemented. So we did what we could back in 2018 and then have just continued to expand and improve it. Talk to other teams. The OFR community is so welcoming and so awesome. I think that COSEP has really laid a great foundation for us to do that. I know I've reached out to other teams, or even when we get together for different webinars and such, and everybody is super welcoming and helpful and is absolutely, willing and ready to answer any questions that people might have. Learn from their mistakes, build on what's already been done. And then I'd say probably don't be afraid to work past the no. Over the years, the Rhode Island OFR has heard no many, many times. I haven't even been around since its inception, and I have heard no multiple times. That's going to be part of the process, right? With anything that's really great that can happen. There's going to be pitfalls, there's going to be dilemmas, but don't give up. Problem solve, strategize. A little bit about what Karina said about really addressing where those issues are, and keep pushing past the no's.
It's great advice. Um, as you all can see here on this call, there are a lot of opportunities for state and local jurisdictions to really implement or expand OFR work in their respected areas. And so, in that regards, there's also a lot of support for teams and interested parties in establishing OFRs. Melissa, could you come off mute and share with us what funding and technical assistance is available currently for OFRs?
Yeah, so just to remind everyone, we here at IAR are the training and technical assistance provider under Comprehensive Opioid Stimulant and Substance Abuse Program, COSEP through BJA for the OFR lane. And so you are welcome at any time, regardless of funding, to come and ask a question and try to understand what tools and resources are available, what other, put you in contact with the Karinas and the Heather around the space. So that is the TTA. In regards to funding within the COSEP program, there's also funding available that can be used to support your OFR and other prevention initiatives that really bring this partnership of public health, public safety, these multidisciplinary approaches. So here is some information about that funding opportunity. It's site-based, there's local, there's state. It's already gone through the application period. We're going to have an award, but they have been coming through pretty consistently. So don't shed too many tears. I can't predict the future, but if past helps, this opportunity will likely come around in some iteration again. Follow up with your state contact. Maybe they applied for it if you're a local site, and understand if they get awarded what they're using those dollars for and if there's an opportunity for you with OFR. There are also funds under the CDC, Center for Disease Control, Overdose to Action, OD2A funds. They also have local and state funding opportunities. SAMHSA recently had a funding announcement, I think last fiscal year or so, that was around harm reduction and really building out harm reduction. But one of the strategies you could do and use funds for was an OFR. We are hearing more from local communities and states that are looking at their settlement dollars and trying to think if OFR makes sense in that regards. And then to Heather's point, and I think Karina also said this, and I try to share it around the idea that you're taking a framework and you could scale it. And so just to begin, sometimes you have to, for your agency or to put an application in, it's helpful to start the process, and do that in-kind dollars if you already have teams together and start working on some of this. And then scale it from there, and do more meetings, more cases, stuff like that. But begin with what you can, regardless of your funding, and try to move this forward. But there are opportunities. I know I went fast through them. Again, if anyone has any questions, they can also join our email exchange and hear what others across the country are using for funding, or any other questions and learn from peers. That's an option available. And there's the TTA request information.
Thank you, Melissa and Karina and Heather. We will come back to you. I wish I could clap loudly for all of you. You've done such a wonderful job so far. But now I'd really like to give our team from LAPA a chance to respond to a few of the questions that we received from our audience. So I welcome the LAPA team up into the virtual stage, if you will. And I will start with Stephanie. What are important points to include for OFR legislation and examples of successful states?
Well, thanks for that, Lauren. First, I just want to introduce myself. My name is Stephanie Noblet. I'm an associate senior legislative attorney with LAPA and was the lead drafter on the OFR model law. And I know Karina, Melissa, and Heather and Lauren were all very helpful with drafting the model and offering their expertise. And I'm so glad that we're all here today, kind of now that the model has been out for about a year and a half, and we're really starting to see it kind of come together and make an impact in states and communities. So I think one thing that's really important, that is really the crux of having legislation, is that ability to share information, the information sharing piece. That's something that states or local jurisdictions without legislation that operate at OFR, which is 100% possible to do without legislation, but they often run into issues with the information sharing, in that they don't have anything in statute that's making it clear to the party that they're requesting information from that it's okay to share. And people get kind of caught up in HIPAA, 42 CFR, other privacy laws, whether that's state or federal, on whether they can share things. So there's kind of this extra caution that kind of prevents things from being shared, and that can really hinder the OFR. So having those provisions that allow for the flow of sharing information really helps an OFR. Now, of course, once you have that law, there still might be some of that hesitancy, and that's where kind of the education comes in and the technical support to make sure that people understand it's okay. This is why we need this information, and this is why it's okay to hand it over, and you don't have to worry about any repercussions. Another thing that I think is really important and that a lot of our reviewers thought was important was also having some confidentiality pieces in place. We have it set up in the model where everyone that is participating in the team has to sign a confidentiality agreement. I think provisions like that help to strengthen the team because everybody knows that they're kind of in there and they're all together, kind of working towards the same goal, and that they're allowed to have these kind of candid conversations, but those conversations aren't going to leave the room, that the information and the privacy of the decedent and their next of kin is protected. We also included kind of criminal and civil provisions if that confidentiality were to be broken. And I think that helps to make the community a little bit more comfortable with what the OFR is doing, knowing that their information is a little bit more secure. And then if anything happens, that there will be repercussions to the OFR team. And I'll let the other three panelists, if you guys have anything you want to add.
I'll just add that that last part that you said is absolutely true. That is something that we lean on a lot, the confidentiality portion of our legislation, particularly in the record space. Not only the record space, but also just having new team members come on, or every now and then, if there's just a concern from an existing team member, we highly rely on talk about somebody actually referred to me as the confidentiality lady one time because of how much I stress it all the time. Because it really does make people feel more comfortable that there is this expectation in place of how things are going to be run, the confidentiality and how it's going to be maintained, as well as protection for them. It definitely increases people's comfortability.
I would say one other thing, just to reinforce with having the law in place, it just brings credibility that this isn't something you yourself came up with, or it maybe not isn't here to stay. It allows for that sustainability and just like that. Hi, reaching out and did you know this exists? I think it just gets you from A to L versus A to B, right? In your conversation with them. It brings you forward faster.
Definitely.
I think for me, I would like to reinforce as a team who was established in a lack of legislation and now does have legislation, again, that it is possible to do it. We implemented our team and had identified case reviews for a full 2 years before legislation, but now we're just so excited to have legislation behind us. And it's really opening doors as far as what information we're now going to have access to and being able to, move some of our members from subject matter expert capacity to providing data and add some additional members who were not willing to participate in any capacity before legislation. So it is possible. It's just easier with legislation.
All right. So, Lap, I want to turn it back to you and ask you this question. What can we do to ensure that the model laws are implemented in the counties, throughout entire states, across the country?
So that's a great question. And I think, first having the model law helps. I think, like kind of Melissa said, it definitely adds legitimacy to the process of OFRs. I think also people knowing that the OFR model was vetted by people that are actually working in the field. It was based off of various OFR legislations that were already in place prior to the model. Maryland was used a lot or is referenced a lot in the model law, as whether some other states. When it comes to a state then implementing it, so the model law establishes or allows a state to then establish county level OFRs. We decided to use making it optional for each county to establish an OFR as opposed to adding in that language shall or requiring it. We kind of went back and forth, but we ultimately decided on making it optional as it might not just be feasible for some of these really rural counties to be able to establish it. So we wanted to try to make it as easy and as approachable as possible, which is why we also added the option that a county could join with one or more counties to create a multi-county OFR that allows kind of these smaller counties or counties with not as many resources as larger counties to kind of pull their resources together and work to address this problem. So while it's not required, we definitely tried to make it as approachable as possible. And that's when I would also say, if a county is hesitant that there's so many resources, especially with COSAP, the technical assistance, the all of the documents, the OFR kind of PDFs and documents that are out there, especially the listserv where you can just directly ask your peers and get answers straight from the source. I think that really helps. So kind of for those that are hesitant, kind of looking around and seeing what other counties and states are doing and just trying to get them to see that, this really is something that is approachable. You have a lot of help out there. And it's not something that you have to go through alone.
Great. And we have one final question before we'll turn it over to Becky and Tara for the audience chat. What is LAPA's perspective on how deflection programs can work in tandem with OFRs to support individuals pre-overdose?
So this was a great question. It was one that we had to kind of think about because we often kind of think of deflection and OFR as being kind of the two extremes. Like OFR is the very beginning or the end, I'm sorry, of kind of the person's life, while the deflection is kind of hopefully getting somebody kind of before they're kind of getting down a path where things can be avoided. I think it's really important to know that these two things kind of, while they're viewed as separate, they can definitely work together. I think it's important to include deflection people on an OFR team, make sure that they're invited to the table and that they're getting their input is heard. I also think that an OFR team can also help provide best practices and also advice to a deflection program. Maybe they identify that, oh, here's a location where there would really be helpful to have a deflection program, or maybe there is a deflection program in place and the OFR is able to kind of see, oh, like you were able to deflect this person from being arrested, but then, 6 months later, something happened. How can we make sure that we kind of come full circle and make sure they're still supported a few months later? So kind of picking up the gaps in that program. So kind of just remembering that all of these programs, whether it's OFR, deflection program, Melissa and Lauren did a presentation on OFR Fast yesterday, that there's all these different entities going about, but they can really all be connected and share resources and ideas.
Amazing. Well, thank you, Stephanie. Thank you, panelists, for sharing on that. Becky, I will turn it over to you.
Wonderful. Thank you all so much. And I appreciate all the perspectives that you all provided. And I also appreciate the questions and conversation that's been happening a little bit in the chat and Q&A. We got a lot of great questions. We also, as I mentioned in the beginning, got a lot of great questions through the registration process too. So I'm going to work through some of the questions we've received. And if you have any more questions, just a reminder, you can type them into the chat or Q&A and we will try to get to them. We have some time. So thank you. The first question I want to ask, and I'll ask Heather to answer first and then maybe pass it on to Karina and then whoever else wants to weigh in. But how often do you find that OFR recommendations are actionable? It's obvious what needs to change in my community, but there are structural and institutional barriers that are extremely resistant to change, and powerful agencies and organizations that are actively exacerbating overdoses. So just, Heather, if you wouldn't mind sharing with us your perspective about really being able to actually take action based on the OFR recommendations, what your experience has been.
Yes. So I will be fully transparent, and this might be helpful for people. So this is actually probably the place, recommendation implementation is probably the place that the Rhode Island OFR has had the most difficulty. And the main reason for that is, right, being on a state level, we have, there's some pros there, right? We do have access to people, the kind of movers and shakers, as I refer to them as, to be able to be sounding boards and kind of move some of the tougher stuff forward, or at least have the connections and relationships to be able to have those conversations to start. So that being said, that is the case. Our team is amazing, and they come up with a lot of recommendations, a lot. I'm talking maybe up to like 30 per meeting. Now, that is not my recommendation. We are actually working on scaling that back and being able to turn some of those ideas more into findings and then separating out to make recommendations more actionable. I actually just became the full-time coordinator, which is very exciting for Rhode Island because it's our first full-time dedicated staff to the OFR in all of these years. And so that is my number one primary focus. That being said, recommendations can be as broad and or as very specific as possible. When you are working from a state level, ours tend to be pretty broad. And I'll give you an example. So for instance, we often come up, I want to say probably every case review, with the recommendation that care coordination needs to be improved. So that might be amongst state treatment facilities, state funded treatment facilities. And so, what our facilitator has started to do is to really pare down during the meetings, right? That's the main place that happens at. And so, she'll ask, for example, so where should this care coordination improvement take place? And once you really start to pare down and really turn to the team, where can you see this happening? That's where we find that we're able to get the most actionable recommendations out of, is when we turn it to the team and we say, so what would this look like? How can this happen? The other thing I'll note here is that we also started having recommendation subcommittee meetings because we don't always, as a state, and reviewing all of the states or having, the over 400 deaths that we have in the state and we have the sample size, we don't always have the ability to do that necessarily in the case review meeting. So we have a recommendation subcommittee meetings, and we have them at least once after every meeting. And we continue to say, where are the places and spaces that we can bring these recommendations to move forward? I think I answered all of that question, but if I'm forgetting anything, please let me know.
That's great, Heather. Thank you. Karina, do you want to provide your perspective on that?
Absolutely. So I agree with Heather that there are a lot of recommendations that are going to come out of your OFR team, and there is no possible way that you could possibly have the capacity to implement all of them. So I think to say, like, how many are actionable is difficult because it really depends on the recommendation. So I know I mentioned earlier, in this presentation that, in the beginning, you're kind of grabbing some of those lower hanging fruit and some of those things that are, a little easier to implement. So for us, naloxone distribution was one of them. Really doing more targeted naloxone distribution, expansion of naloxone distribution. For us, that's one that we didn't hit too many barriers. We also do specific meetings for just kind of deciding which recommendations we are going to work on. So the way that we do it is that we have our case review meetings every month and we generate a ton of recommendations. And then every 6 months, we sit down as a team and we kind of present, okay, out of all of the recommendations, these are the ones that are coming up the most. And we kind of talk about which ones do we want to focus on, and then give ownership and like what are the next steps to actually implementing these, and also give updates on any outstanding recommendations that we had decided to work on, kind of what is the status of those. So I think there are definitely actionable recommendations, and there are recommendations that you are going to hit roadblocks. And sometimes they are going to take a long time. So for instance, we had a lot of recommendations around targeted services for children who are, living in households with family members who are utilizing drugs. And it took me 2 years to fund it. So it had been, on our recommendations for 2 years before I was able to get the funding to implement it. So sometimes it's really, how Heather said, keep pushing past that no. You're going to get a lot of no's. And sometimes, hopefully, you'll eventually get a yes. So I hope that answers the question as well.
That's very helpful, Karina. Thank you. Melissa or Lauren? Melissa. Yeah. Sorry, I can't help myself. So I think there are like everything said, and then just a couple more ideas. One is really making sure you're looking at your population community context data so people see the depth and breadth that this recommendation could impact, right? So if you're making your recommendations about linkage to care post, you know, release and making sure that that's flowing, that you then go back and find out how many people in their care plan had linkage to care, or their release plan had linkage to care. Then you can be like, this, if we did this, this would impact these number of individuals in their release plan. So like really quantifying it beyond just, we noticed it. So really working with your aggregate data. I know another thing that we talk about is making sure you have some high level decision makers you can report out to that maybe they can maneuver and move resources or priorities to say, oh, that aligns with some other strategy we've talked about. Let's see what we can do to address that. So really making sure you have what we call governing committee in place. And then the other item I would say is while we talk about looking at data and community context and our data partners at the table, really understanding everyone's programmatic focus. So how their agency operates or any new grant funding or prevention dollars. And then maybe walking it over to that new grant that's supposed to be doing naloxone distribution and saying, hey, did you know we came up with these things that might inform your new program that you've developed? And that can be a way to make new partnerships too. So I mean, those are just some additional ideas, but it's hard work. Most of the work in an OFR happens outside of the meetings, right? So this just reinforces that.
Thank you. Thanks for providing that perspective. I appreciate that.
Stephanie, I want to call on you. There's some questions that came in that we'd love to hear from you on, and anybody else that wants to weigh in, of course. The first one is, are there protections in the legislation, the model legislation that prevents law enforcement from using information for surveillance and enforcement purposes, like we've seen with the OD? So if you could comment on that question, that'd be great.
Yeah, that's a great question. And like I said earlier, confidentiality is so important with the OFR, both for the team to be able to make sure that they're able to talk candidly about the cases, and also just for protection of the decedent and their next of kin to make sure that they feel comfortable that their information isn't just going to be broadcasted to everyone and everywhere. So because of that, we actually did include provisions within the model that were related to this. So if you are actually looking at the model, if you do have that in front of you or you're looking at it later, section 9 is a section on confidentiality. And we include a provision on discovery. So we state that all information and records acquired by the local team are not subject to subpoena, discovery, or introduction into evidence in a civil or criminal proceeding or disciplinary action. And we also include a provision that local team members or any individuals who are present at the team review are not allowed to be questioned in any civil or criminal proceeding or disciplinary action regarding the information presented and provided at a team meeting. So those two provisions kind of really help ensure the confidentiality and prevent it from kind of being used kind of either against the decedent or their next of kin.
Thank you, Stephanie. I appreciate that. Heather, anything to add from your state legislative perspective in Rhode Island around that?
I will
issue?
say that the clause that Stephanie read is actually, we have that almost word for word in our legislation. Again, makes people feel more comfortable and does allow us to remind people that that is in there. The other thing I want to say is that making sure, right, that you're people, you have flexibility and choice about who is on your team. And so it's up to kind of you to be able to find a champion or to be able to find everybody that's on your team, right? You do get to know. And so you want to make sure that you're choosing your team members appropriately and accordingly so that that those concerns are much more mitigated than just kind of, getting to know your OFR team members to make sure that who you choose, whether it's law enforcement, it doesn't matter who it is, are willing and able to uphold that confidentiality clause.
Great. Thank you, Heather. And thank you, Stephanie. Stephanie, I'm going to come back to you with a question that came in from the state of Washington. How do you find out, or how do you find information on how closely a state law conforms to the model legislation? What would be your recommendation around that?
Great question. And actually, Becky, I think it would be a good time to pull up our map. But this is something that we do keep track of at LAPA. We look for bills and established laws that have passed since the introduction of the model, and we track how closely the provisions match the model. And this is a document that we're working on, and we're hoping to get that out hopefully by the end of the year, if not sooner. But it is something we keep track of. If you're interested in learning that, whether it's the person that asked the question from Washington or somebody else, feel free to send me an email. I'll drop my email in the chat, and I can get that information over to you. But right here on the screen that Becky has shared, this is a map of OFR teams that we have identified by whether they're operational on the state level, the county level, or both. And that's something we share. So Washington is actually pretty close to the model. Some other states with legislation that are pretty close to the model are Pennsylvania's 2022 legislation that came out, New Jersey and Nebraska. There's additionally some bills out there that are currently not enacted yet, but are similar to the OFR model, which include Tennessee, Michigan, and Wisconsin. So it's something we keep track of. And like I said, if you ever have a question about that, you can email me and I can give you a more detailed example about what's similar, what's different to the model. Yeah, and if you are aware of your state that's going to be introducing a bill, feel free to reach out to us and let us know if, maybe we missed it, and we can help start keeping track of that as well.
Great. Thank you, Stephanie. I appreciate that. Also, we have another question from Washington, the state of Washington. And Karina, I'm actually going to ask your perspective, and then any others who want to share about OFRs in rural jurisdictions. But so the attendee is setting up an OFR in Spokane County, Washington, and they have the largest city in Washington, but the rest of the county is extremely rural. And the question is, how can they be flexible enough to include the needs of rural communities? Does anyone?
Maybe should browse. Lauren, do you see the question? Yes, yeah.
Yeah, I do. The question is, how can we be flexible enough to include the needs of rural communities? Does anyone here have a similar demographic in their jurisdiction?
So we do actually have a pretty similar demographic in our county. Scranton is by far our largest city, which is where our district attorney's office is housed. And the majority of our overdoses do take place, but we do also have a pretty expansive, the rest of our county is quite rural. So I think that as far as speaking to the question, I think it's having a variety of people at the table and then just letting the conversations flow, kind of having some of those representatives from the city, but also having people who are representative of the more oral, the more rural areas, and then really just looking at the cases as they come through and then discussing, how that is different in different areas, and making sure that you do review cases of overdoses in both the more city areas and in the more rural areas. But I think it just organically will happen to include both, as long as you make sure that you have a mix of people at the table and review a mixture of cases. Does that make sense?
Thank you, Karina. I appreciate that. Does anybody else want to weigh in on, the rural perspective?
I can speak to that on a state level. So what we've done, because we do operate at a state level, is to do geographic regions. And so what we'll do is focus on deaths that have happened in a specific region. So in this example, we can pick rural. Our rural areas. There's no really real rural area of Rhode Island, just to be clear. You can get from one side of the state to the other in less than an hour. So our definition of rural is very different probably from the rest of the country's. But that being said, and what we have invited guests, right? So we have our team that meets together for every case review. But then depending on the topic or the focus of each meeting, we do have guests come in to offer their subject matter expertise. So I would recommend maybe holding a geographic type, if you're on a state level geographic type meeting, and then you can invite experts from that particular geographic region to be able to speak to their needs and how what's being discussed can apply to that particular area.
And I just have one more thing to kind of think through, and I'm stating the obvious, but I've learned to just state it, right? Is that we live across geopolitical boundaries, right? So like even counties, sometimes someone lives here and they spend most of their waking hours over in this county and they may have died in that county or died in this county. And that is true also for urban and rural, right? So thinking about what providers they're accessing, they may live in a rural community, but they may need to drive to the urban area to access it. So thinking about it, being mindful of that that challenge, but not assuming that they're getting their needs met in the community they live, and really kind of letting the story navigate you in some ways of what providers need to be in this space. I don't know if that makes sense or anything, but
That's great, Melissa. Thank you very much. I appreciate everybody's perspective. And thanks for the questions that came in too. Lauren, I'm going to turn it back to you to for final comments.
Absolutely. Thank you. So I'd love each of the panelists to kind of give a really brief 1 minute summary to this question, giving advice to OFR. So given what you know now, what piece of advice would you give yourself back when you started implementing your OFR? And Karina, I will start with you.
So I think for me, it really does come back to, meeting people where you're at and just starting, and, not having unrealistic expectations and just kind of figuring it out as we go along. OFR is difficult and is going to be different in every single space. So you can, design it to be what you think it's going to be, but staying open to the fact that that is realistically not probably what it's going to be and maintaining that level of flexibility. So just to, get started and give yourself some grace because it is difficult work and you are going to need the flexibility to continue to move forward. So just acknowledging that and, continuing to address things as they come along.
Great. Heather, how about you?
I second the flexibility from Karina. And then I would probably say take care of yourself and your team. That is a huge part of being able to continue to do this work and no matter where you are at in your process, to continue to be able to do it on a long-term basis. It can be daunting. It can be emotionally draining at times. But if you take care of yourself and you set yourself up for success to be taken care of, as well as that for your team, COSUP has great resources on self-care strategies for teams. I highly recommend that, or even tapping into some of your team members for that might be on the clinical side, for ideas on how to be able to support your team and for them to support one another. Structuring your day in a way that OFR maybe takes up a portion of it, and then you're giving yourself breaks afterwards, asking the team what they need. We've done that as well. And so really focusing on that self-care because not only yourself, but your team members will get burnt out. It will happen. And we embrace that in Rhode Island, very transparently and openly. And team members, everybody has a delegate. And so we know that somebody might take kind of a month off from OFR or in their other spaces. In Rhode Island, a lot of our team members cross over into multiple overdose prevention spaces. And so they might step away for a month and then have their delegate attend in their stead who provides the same level of expertise, if that's needed. And that's very open conversation that they have with me. And then they come back and they're refreshed and they just take some time to take care of themselves. So highly recommend that you put focus on that.
And Melissa?
All right. If you grew up when I did, when there was recycle, reuse, I don't remember that one. Reduce. I'm doing the 3 R's here. Reflect, like consistently reflect as you do your work and think about how to improve it. Everything they said, but reflect. Use your resources, whether it's people that you met here today, other teams, your state. Use resources, and then the third R is reward. Don't hesitate to acknowledge the things everyone around the team has and is doing to address this, because it is hard work and like you're climbing the mountain, but if you look back, you'd see you made it quite a way from base camp. And so acknowledging all those moments of movement forward can really help everyone stay focused. So reflect, resources, and reward. Lauren?
Thank you. And I absolutely love this question, so I can't help myself. I'd love to weigh in on this, having done this in my prior experience. But I think teams really should remember that a win is a win. Small changes are huge victories along the way. They're just as important as big changes, big recommendations. You don't have to wait to hit a home run with the most perfect recommendations. Start off small, build your relationships in the room, and you will really achieve those small outcomes that, as Melissa pointed out, should be celebrated and reflected on. And then I want to echo that: ask for help, you reach out. You're not alone in this work. It can feel very isolating at times, and it can feel very hard. These are hard cases to review, and there is a roadmap, and there are resources, and there are lots of teams across the country who are willing and ready to share their experiences and their tips and tricks and resources. Go visit the COSUP website, check out all of the OFR resources. You're not alone in this work, and we are here to support you. So those are some things I wish I would have known when I was first starting out. So with that, I will thank you to our panelists so much for spending the afternoon with us, and I will turn it back over to Becky.
Thank you all so much, Lauren, and all the panelists. I appreciate it. What inspiring words and great recommendations to leave us all with today. I appreciate the discussion. This was a great discussion. Thanks for the questions. Really special thanks to our moderator, Lauren, for sharing your expertise and guiding this discussion. And to Melissa, Karina, and Heather for sharing all of your experiences with us. Made for a wonderful conversation. And to Stephanie from LAPA and the entire LAPA team for all the resources that you shared on the model legislation. We hope that we're leaving you with a wealth of information, recommendations, ideas, and resources to help you all find your way with OLRs in your communities. You will see that we posted a survey in the chat. Your feedback is very important to us. So I ask that you click on that link if you can right now before you disconnect, and take 5 minutes to answer a few questions. It will be a very brief survey. Thank you for doing that. We'll also send that in a follow-up email. This recording, as I mentioned in the beginning, will be made available on our Knowledge Labs tab on LAPA's website, along with many other resources, including additional previously recorded information on the topic from some speakers, and also information on other Knowledge Labs. And we'll send that out once the recording is available, but it should be soon. We also encourage you to sign up for LAPA updates. You can do so on LAPA's website at the bottom of the page where it reads join our mailing list. So you can get information about upcoming Knowledge Labs and any other resources related to this topic and the other work they do. So a huge thank you again to ODCP for funding and otherwise supporting this event. We appreciate your support. And we do hope you'll join us for future Knowledge Labs. This is our second in our series of 6 Knowledge Labs, and we have additional ones coming up with other experts who are going to discuss overdose and prevention and treatment in correctional settings, school-based overdose prevention, substance use during pregnancy, treatment in emergency department settings. And our next Knowledge Lab is going to be on the correctional settings, scheduled for September 12th at 2 p.m. And I did post the registration link in the chat as well. So we hope you'll join us for future Knowledge Lab. So thank you all again to our panelists and speakers, and to all of you for attending. And I hope you have a great day. Take care.